Do you have any laughing gas?
Yeah, we have laughing gas.
Yes, we got laughing gas, baby. That's all I wanted to know. When we come back, teeth in an hour or 22 minutes if you read the fine print. But we're going to be doing that when we come back. Are you ready?
I'm ready.
All right. We got teeth in an hour starting when we come back. Bye, guys.
Laughing gas for 3 hours.
We've seen laughing gas before.
That's just how we roll. Laughing gas.
See ya.
Bye, guys.
All right, we told you about sharks getting new teeth every 2 weeks, but Big Buddha can better that. It's actually in an hour, less than an hour.
22 minutes, I think.
Yeah, that's what they're doing. A new dental procedure called Teeth in an Hour this morning.
I don't think the procedure is called teeth in an hour. I think it's called something more scientific than that, like teethalosis tuberculosis.
You think so? No, I think when the dentists were coming up with this, that's what
the laughing gas is working because that wasn't that funny, and Susan's laughing. Yeah, it wasn't that funny. Let me see if it works. Knock, knock. Oh, look at that. Didn't even get to the punchline and she's laughing. Laughing gas is working. So, Dr. Hamblin, let's explain, you know, we're not going to show it on Susan, but let's explain what you've done already so people at home kind of get a better grasp of what's happening.
Okay, this is a model of Susan's jaw, and basically this is all she has left is her front 6 teeth. And so while we were gone away at sports or weather or wherever you guys were, we
potty break. We took a potty break.
Potty break.
Yeah,
okay.
Yeah.
Anyway, so we started to prepare the sites to place the implants using a precision surgical guide, which is generated from a CAT scan and a special software, and we'll show you the CAT scan and the software.
Is that to give you a more precise placing of where to drill?
Absolutely. The X-ray that we have in most dental offices is just called a Panorex, and that's a 2-dimensional picture. And in the CAT scan, the dental CAT scan, and I believe there's only one in Utah, gives us a 3-dimensional picture. So it gives us a very precise 3D picture of her jawbone, her tissue, everything that we need to see. So it makes it very precision.
So what is the scientific term for teeth in an hour? Do you have a scientific term?
That is the term.
I thought you were going to give me something.
Yeah. No, teeth in an hour is a term used by Nobel Biocare. It's the company that invented it. There's another procedure and is called teeth in a day. But the bottom line is you get your teeth right away. So it may take 22 minutes. It depends on the health and quality of the bone, but it may take a couple of hours.
Now, what are you going to use? What's the material that's going to be the replacement teeth made out of?
Well, the implants themselves are made out of pure titanium, and bone loves titanium. So that's where the research comes in. Is when we put in the titanium, the bone starts to grow and fuse with the bone. Now, the scientific term for that is osseointegration.
Yeah, I like teeth in an hour. We're going to stay with teeth in an hour. Hey, look, laughing again. The laughing gas is working. So we'll go ahead and work on Susan. And when we come back, we're going to just keep checking it. Can we just take a look at the progress? Is that possible? Is there any progress to be seen?
Yeah, I mean, basically you'll see the little holes that we didn't make any incisions, but there's just little precision holes where the implants are going to go in. And we were just about to that point, and then so when we come back next time, we'll be placing the implants.
Okay. So when we come back, we're going to place some implants in there. And for those of you who are looking for, look,
you found it on the web.
Laughing gas is working good, man. That's what I'm talking about. So, Doc, walk us through what's happening right now.
Well, right now we're just going to show you putting an implant in. This is the implant right here. And
now, before you do that, I want to warn people: there's no drilling. This is not. You're not doing any drilling right now. It's not going to hurt.
This isn't going to hurt.
Right.
It's. I wouldn't call it drilling. We're screwing in the implant.
Okay, but it's already pre-drilled.
Pre-drilled. Yeah.
Yeah. Okay. Just want people at home to know that.
And the light's off just for the cameras, and it just threads right in, and it'll get to a certain point. Okay. So now it's about halfway in, and then we'll torque it in the rest of the way with an actual torque wrench.
And Susan, since you can't talk, let's look at her feet for a response. 2 shakes if you're doing good. Okay.
Okay.
How about the between 1 and 10, the pain level, if there's any pain, between 1 and 10, tap your feet. No pain, no pain, no pain.
So this is just like a regular
like you're working on a car.
Like working on a car, you got to torque things into a certain...
Except it's in the mouth.
It's in the mouth, that's right.
All right, when we come back, we're going to go to the next stage of teeth analysis. Or teeth in an hour.
I'm sick of this.
Yeah. She can't watch.
We'll see you guys in a little bit. Bye, guys. Oh, we got a thumbs up. We got a thumbs up.
On a car.
No, no more.
There you go. We got a thumbs up. All right.
On top of that, so we're actually doing something similar to this. 3 teeth on each side. She doesn't have any back teeth at all, and so those will be rock solid when we're done. What happens over time when people lose teeth is their jaw actually melts away. And so this is showing a jaw with a full set of teeth, and this might be, you know, a few years later after having their teeth removed, and that might be 10 years later, and this might be 25 years later. And that's why people with dentures, a lot of our patients are people that don't have any teeth at all, and they've been told there's no hope, you can't, you know, you're just going to have to eat baby food and stuff put through the blender, and that's just not the case.
What's wrong with baby food? I like baby food.
Yeah.
Gerber is pretty good. You know, when you have the
okay.
dessert, you should try the blueberry pie that's mixed.
It's been a while since I've had baby food.
Well, I'm just saying, don't knock baby food, doctor.
Okay.
It's pretty good. Don't. All right. So, what about pain? People are thinking, oh, those are bolts and screws and stuff in the bone. It's gotta hurt.
Yeah. There's actually no real nerves in the bone, and so it's a lot less painful than having a root canal done or anything like that, because the teeth have nerves in them, and so.
What about when you bite into ice cream and it's really cold because it's titanium? Will it make everything else cold as well? Or
not at all. The titanium won't decay. There's no cold sensitivity. The only thing that you have to be aware of is you have to maintain them at home with good flossing and brushing, and they should last a lifetime.
Okay. Well, we're going to check in with Susan when we come back, and don't knock baby food. Don't. I like baby food. Don't. All right?
All right.
You want to try some?
No, no.
Okay, just check.
I eat baby food.
I know you do, Dan.
But it's not the only thing that I eat, and that's the thing. You know, you don't want to be eating that the rest of
I'm
your
here to clear the record.
solely.
That is the only thing you eat. I've seen your bag. That's the only thing you eat.
It was on sale.
That's
so.
why Carrie doesn't want to sit next to you, because you eat baby food.
He's got baby food breath.
We're checking in with Susan when we come back. Bye, guys.
Baby breath.
Buddha hanging out, checking out the happy gas this morning, just making sure it works.
I just want to make sure that Susan is safe. So if the gas is not working, she's it sounds like it's working.
It's off now. We've got her off right now here for a minute.
So bring us up to speed. Where are we at now, Doc?
Well, we've placed all 6 implants, as you can see on the digital x-ray that we just took. That's a digital Panorex, so you can see the 6 upper implants that we just placed. And the 4 lower implants were placed a few months ago, so she's got lower teeth. The digital x-ray is about 90% less radiation than traditional x-rays. Now if we look in her mouth, let's see, open a little wider. You can see way back here in the back she has back teeth now. So before she came in, she had no back teeth. So those are temporary crowns. They'll be in there for a few weeks while the tissue heals and matures and the implants fuse or osseo-integrate with the bone, or whatever that term we were using now.
Teeth soup analysis.
Teeth soup analysis.
Yeah. Why am I the only one that knows the term? No, just kidding. When we come back, thanks for the product. When we come back, we're going to step into doctor's office. We're going to see some before and after shots, plus talk about the other procedures they have here. 801 is the area code. All smile. 255-7645 is the number to call. You know, to see if Dr. Hamblin can help you out. We wanted to show you some before and afters, just to show you what kind of magic, I'm calling it magic now, that this man works with. But let's talk about, you do all kinds of services. You mostly focus on the implants.
The dental implants and cosmetic dentistry. This patient here is a before patient. He drove up, he's mayor of a small town near Bryce,
and he still got voted with his teeth.
Yeah. And I wish I had the after letter he sent us. He sent us a very nice letter. But this is afterwards. Wow. And that's just done with 4 porcelain veneers. Those are called luminaires. There's no shots, there's no drilling. Basically, it's a piece of porcelain, custom made to fit right over his
I wanted to show
mouth.
this one as well. I don't know if you can get a shot of that. That's pretty dramatic. Danny, Carey, that's pretty dramatic.
This person had a root canal tooth that went bad. We had to extract it, put an implant in, and then put a crown in there.
Wow.
And so dental implants are for replacing one tooth or a whole set of teeth. And this case here, this was the after of Carlin Johnson. That's his before. and that's his after there.
Very, very
So-
nice. Very, very nice.
These 4 are just porcelain veneers. They're
Okay.
called luminaires, and they're just bonded in, and it takes about 2 weeks lab time to get done.
When we come back, we're going to check on the progress. It looks, Susan's almost done. You're going to be amazed by the results. We'll tell you all about it. All Smile is the number, 255-7645, right?
That's right. Every patient's different. Every case is different. With dental, if you have dental insurance, placing a single tooth implant versus doing a bridge where we have to grind down the 2 adjacent teeth, the fee's about the same. And a lot of insurances are covering that now. For someone who's missing all of their teeth, it can cost as much as a new car. And in 20 years, I've only had 1 medical insurance pay, but it was basically because a patient was starving to death. He went from 195 down to 135 pounds in about 3 months.
Wow.
With dentures, and then we put the implants in, and he started to gain weight back and doing great. So.
Just thinking along the lines of regular Joes and how regular people think, how good, people are at home watching, well, how good is he? What has he done? You actually used to be the team dentist for the Oakland A's, right?
Yeah.
Or for one of the Oakland A's. So was it Jose Canseco?
No, I was the team dentist for the A's.
Oh,
so
wow.
Jose Canseco, Dennis Eckersley, all the old name guys. None of the new players that people know nowadays. But
How long were you the team dentist?
About 15 years.
Wow.
Yeah, I had a practice in Danville, California for 20 years. And we moved to Alpine in '97 for family reasons. I commuted for 8 years back to the Bay Area to my practice there. And then so we've been here a year and just excited to be doing dental implants because that's my passion.
Again, just so that people are like, well, who's he worked on? Well, there you go. The entire Oakland A's, old A's, not new A's, old A's.
Yeah.
Retired A's. So let's reveal again. You ready, Susan? How are you feeling?
Fine.
No pain at all. You said you had no pain at all.
No.
Okay. So let's go ahead and show them off, doctor.
Okay. Well, if this is what she came in with, basically just 6 teeth in the front, and they were old crowns and no back teeth. And let's show her off. Let's see. She's got.
Look at that.
Now these are temporaries, and she'll come back, a few weeks later and get her permanent ones in. But this is the front 6 new teeth, and then if you can see way in the back, to her head back.
Yeah.
Can you catch that on the camera? You can see she's got all back teeth too, and those are solid. She can chew, well, maybe not the hard candy right away, but she can.
But soon.
Corn on the cob,
Okay.
stuff like that.
Well, doctor, thank you. We can't shake hands because I just saw where your hand went. But okay. Oh, there we go. Okay. Susan,
was great
thank you
having you.
so much. All Smiles is the number to call, 255-7645. We're out of time. You got a great smile. We'll see you tomorrow on Good Day Utah. Say goodbye for me, Susan.
Bye.
Thank you.
See ya.